Look Good Feel Better helps patients deal with the appearance-related side effects of their cancer treatment.
I think your self-esteem and your self-image gets a bit of a battering when you have cancer. It does.
I think it's really important to be able to show cancer patients how to do their makeup because, you know, of course they're still women, but they've lost some parts of their femininity, whether it's they've lost their eyebrows or they've got high colourings.
I'd never realised how much it had affected women and affected their self-image, which was a huge part of what the treatment does as opposed to the actual cancer. Like loss of hair, skin problems, possible surgery which, you know, kind of affect your body image. So from that point of view I had never thought about it, but when I started working with the programme it is such a huge factor, and to be able to make somebody feel better about themselves and to give them back even some control back over their image was a huge plus for me. I can't go in and nurse people, I can't go in and help them in other ways, but I can do this programme and it's very easy for me to do it because I enjoy doing it.
The workshop begins with skincare, cleansing, toning, moisturising. Then we move on to makeup, and we'd have all the products there as well. So foundation, powder, blush. Then moving on to eyes, and of course for the women who have undergone treatment or are currently undergoing treatment, the loss of eyebrows and eyelashes are a huge thing. So we would concentrate quite a bit on how to draw in eyebrows, how to camouflage the loss of eyelashes.
I usually come in at the end of the workshop. When all the women have their makeup on and they've done their eyebrows and their eyelashes, and we just generally talk a little bit about if they're losing their hair, if they're wearing a wig, are they comfortable wearing the wig, do they need any tips or advice on how to make it more comfortable, how to make it look more natural. Some people don't like wearing wigs, so we would kind of talk about the other options. If you don't want to wear a wig, there's lots of headwear. Sometimes when they're getting their wigs fitted, there's too much going on and they're taking in so much information that they actually haven't really listened to that. So this day is a day when they're focused on their appearance.
Patients go to hospital for all the kind of nasty things, as I call them. You know, the scans, the surgery, the treatments, the injections, the blood tests. So it's always quite tense. Whereas this is something that we can offer in the hospital that is really nice. It's in probably a boardroom or a very nice room in the hospital. The whole setup around the workshop is very caring of the women.
We've all got really busy lives, but I still don't want to not do it. You know, I could easily say, okay, I just don't have time for this, but I'm still trying to find a way to make it happen and to still be a part of it.
I would encourage any makeup artist or any hairdresser, if you've got any free time, even if it's only, you know, being able to do it, even if it's only once a year or, you know, twice a year, or if you could do it 10 times a year, it'd be brilliant, but you would really, really enjoy the experience and you would really feel like you've really done a good day's work as well. I mean, even though it is a voluntary job, but you would feel like you'd achieved a lot in that day.
I do one once a month in Beaumont Hospital, and sometimes if I might fill in somewhere along the line if somebody else can't do a programme. So it's not a lot of time, it really isn't, you know, and it's so worth it. I actually think I get more out of it than the women do. I really do. I walk out of there and I just think, my God, women, like, people are so great. And also, it puts your own stuff into perspective as well, you know. You're worrying because your boiler's broken down. Your boiler can be fixed. You know, if somebody tells you you've got cancer, that's a whole other ballgame. Or your mum has got cancer, your sister's got cancer, your daughter's got cancer. That's a serious problem.